All right, treating endometriosis from a hormone balancing perspective. Let's go! Hi, I'm Dr. Joyce Knieff. I am a naturopathic doctor practicing in the state of Minnesota. So in endometriosis, a big portion of the pathogenesis that we know about endometriosis, it is definitely hormone sensitive. And it's hormone sensitive in the way where it's worse when you have more estrogen and less of the other hormones that balance it out. And this can be why conventional therapies like putting people on oral contraceptives can be so helpful, because it basically forces a balance of the endocrine system in terms of the way that it's producing hormones. From a natural perspective, what we can do here then is aid in the detoxification of the estrogen. So if we're thinking about estrogen as in a bucket in your body, then what we can do are two different things here. We can help your body detox the estrogen a little bit faster, or we can turn off the faucet here and reduce the production of your body's estrogen. There's like a third secret option here too, because we know that with the development of endometriosis, it tends to worsen with unopposed estrogen. Unopposed meaning it's not opposed by progesterone. So we can also try to see if we can upregulate the production of progesterone, or at least get your body to balance the production of progesterone and estrogen in order to further regulate what's going on with the endometriosis. So from a detoxification standpoint, some of you have already heard me talk about this. Mainly, we want to help the body detoxify estrogens. From a phase 2 pathway perspective, this is mainly going to be done through glucuronidation, which means that you need to have a good gut microbiome that doesn't have high beta-glucuronidase activity. You can test for this in a stool test, and ideally, you would modify the gut microbiome so that your biome has less of this beta-glucuronidase activity that undoes your detoxification. In the short term, you can supplement with something called CDG. CDG basically just gives like a little decoy for the beta-glucuronidase, high beta-glucuronidase activity gut microbiome to like work on, instead of undoing the glucuronidation that your liver has done to the estrogen to be able to get rid of it. Other things that can help with the phase 2 standpoint is like upregulating the UGT enzymes, which involves things like having enough glycine, magnesium, vitamin B1, B2, B3 to be able to properly detoxify estrogens. And in terms of like phase 1 detoxification in the liver for estrogens, this is where you can kind of push phase 1 CYP enzymes by using things like DIM. DIM in particular can help a lot with detoxifying estrogens and upregulating the liver enzymes that help with the detoxification of estrogens. Let me go over a little bit about the hormone balancing portion in terms of like the faucet piece in another video here, because just want to try to keep everything a little bit more bite-sized here, so stay tuned. So even though we're not sure how endometriosis happens, we're pretty sure about some of the mechanisms in which it works currently in the body if you do have developed endometriosis. So this begs the question of, how can endometriosis be treated? Hi, I'm Dr. Joyce Knieff. I'm a naturopathic doctor and I practice in the state of Minnesota. So I will say the first time that I've ever treated endometriosis was a few years ago. At this point, probably 5 years ago. And when I first encountered the patient who was really, really suffering from endometriosis, she also had adenomyosis. And so I threw the literal kitchen sink at her. And I don't remember my exact protocol, but I know there was Vitex, DIM, I3C for like estrogen and hormonal balance. And then there was also NAC, pycnogenol, resveratrol, curcumin, fish oil. There was just a lot. She was willing to entertain me on this, and I also did like a bunch of Chinese herbs with her too. And we did end up having good effects. So she has pretty good pain control these days, and we have experimented with like backing off some of these supplements and things and seeing which ones of these things are actually really helping her maintain her symptom control. And I think sort of kind of like as a spoiler to the story, when you as a single person go through the evolution of your life, things can be different, just like how things are different for every different person. When you move through life, the seasons of your life and the different stressors that you encounter can be different, and the supplements that you need to push you back into balance can be different as well. And I would say with my current experience in treating endometriosis and helping people with endometriosis and adenomyosis, I think the therapeutics fall under 3 main categories: anti-inflammation, hormone balancing and reducing like symptoms like bleeding and pain. So yeah, let me talk a little bit more about endometriosis this week. Stay tuned. This is such a good point. I was going to use another comment that asked how to make endometriosis completely go away to talk about this, but I think this comment encapsulates what I want to talk about a little bit more. Hi, I'm Dr. Joyce Knieff. I'm a naturopathic doctor practicing in the state of Minnesota. And this topic goes a little bit more into medical humanities. And when we talk about treatment, there's different goals to treatment, and that's not always clear. And I know I've been sort of unspecific about my wording of my usage of the word treatment, but let's go ahead and break this down. And I'm borrowing a lot from like the terminology that is typically used in cancer care. But in general, there are different goals to treatment, and this is especially obvious in something like cancer care. Because in cancer, to cure is not always the treatment goal. And generally speaking, there are 3 different goals to treatment in cancer care. There's palliative care, there's potentially life-prolonging care, PLP care, and then there is curative care. So if we were to apply these concepts to the treatment of other conditions, I would say more that there's a curative treatment, there's potentially harm reduction treatments, and then there's palliative treatments. So if we were to apply this to the treatment of endometriosis, which I think is very apt because right now there's no good way to definitively diagnose endometriosis without laparoscopic surgery. So in order for you to know definitively that you have endometriosis, you have to go under surgery. And at that point, you might as well go in there. Like at that point, you're already under surgery. So if you see the endometriosis lesions, you remove them. That's diagnosis and treatment tied up into one. And that excision surgery is considered more curative than other forms of treatment for endometriosis because it is. And it's after the excision surgery that you can kind of take your understanding of endometriosis and try to enhance the treatment outcomes so that endometriosis does not reoccur or the lesions don't grow back or spread again. And I think specifically with endometriosis, it's a little bit of a difficult conversation. It's hard to tease apart because a lot of the discourse around endometriosis kind of conflates treatment and diagnosis together. So if you've never had laparoscopic exploratory surgery to see whether or not you have endometriosis lesions, it's technically not gold standard diagnosis. We can see a lot on transvaginal ultrasound, especially if there are ovarian endometriomas. That's where we can best see whether or not there are like endometriomas that are happening on the ovaries. But in terms of like superficial and deep lesions on all other organs, in the pelvic cavity or in the abdominal cavity, it's very, very difficult to see on ultrasound, so that diagnosis is not definitive. But then we're left with a patient who has a lot of symptoms. And with these symptoms, it's also really difficult with endometriosis because there can, like the risk-benefit ratio of going under for surgery to get this diagnosis versus the current level of suffering that's like a very individualized conversation. And a lot of times the balance of this is very difficult because the symptoms of endometriosis can be very easily conflated with like what are natural discomforts with the menstrual cycle. And if you have terrible dysmenorrhea, is that the same as endometriosis? And oftentimes it's not. And we know this because some people have more pain with the menstrual cycle even without having endometriosis. But if it's not worth it for this person to go under surgery to get a definitive diagnosis of endometriosis, we can still ease their pain by applying a lot of the same therapies that would work for endometriosis. And then if this person does improve all the way to the point where they no longer have any pain with their menstrual cycle, does that mean we cured their endometriosis? Not really, because we never knew in the first place whether or not they definitively had endometriosis. We were just going off of the symptoms of dysmenorrhea. And there's a whole other topic encapsulated here where is it always necessary to obtain a diagnosis before you initiate treatment? And a lot of the times for harm reduction, it's not really. if there's something going on and the stakes of diagnosis are too high, in this case with endometriosis going under surgery to obtain a diagnosis, if someone isn't having that much pain yet, and we're assuming that maybe there's something going on, we can apply other therapeutics to see if we can help their suffering in that moment before we get to the point where their pain is so bad that they have to go under surgery. And this also makes endometriosis really hard to study, right? If the stakes of diagnosis are so high, it's unethical to put someone under anesthesia, do exploratory surgery, confirm that there's endometriosis there, and do absolutely nothing about it, and then have them go home, do sort of like hormone regulation therapies to see if the endometriosis then goes away from that, and then put them under surgery again to check to see whether or not the lesions are still there. That would be an extremely unethical study. So I don't know if I'm being as eloquent as I want to be in this morning, but I think with a lot of endometriosis, especially if it has been endometriosis that has been diagnosed on laparoscopy and excision surgery has been done before, and the patient is having recurrence of symptoms, but not to the point that it was before, that's a case where we're treating empirically a lot of the times to reduce the patient's suffering and the patient's pain and the patient's symptoms. Does that mean that they had a reoccurrence of their endometriosis? We don't know. We don't know until they go under the knife again to see whether or not there are endometriomas or endometriosis lesions that are present again like it was before. So hopefully that made sense. A lot of the therapies, the natural therapies that are given with the understanding of how endometriosis works are mainly like an enhanced version of giving oral contraceptive pills to control the symptoms of endometriosis. So a lot of the therapies with like hormonal balance and inflammation control, all of these, the goal of some of these natural hormone balancing therapeutics are to make sure that your own hormones are balanced in a way that discourages the growth of endometriosis, instead of using like an entirely external agent to kind of overhaul your hormonal control, in which I'm referring to birth control, in which case, like if you were to remove that external control completely, you would almost certainly have a recurrence of your symptoms. So hopefully that helped. But this is a really good thing to keep in mind, and a really good, I think this is a very good medical medical philosophy, and talking about this to your patient in terms of the pros and cons of treatment, and making sure that assumptions are aligned with the outcome of the treatment. Hope that helped. Treating endometriosis from a hormone balancing perspective. This is part 2, where we're talking more about the faucet piece, balancing the production of hormones rather than addressing the detoxification of the hormones. So the previous video was on the detoxification of hormones, basically upregulating the rate in which estrogens are being detoxified. Here, let's talk a little bit more about the production of hormones and how hormones are regulated. So just a very basic overview, you have this thing in your brain called the pituitary gland. The pituitary gland is like your master controller of all of your endocrine functions, and the pituitary gland will send signals to your ovaries to be able to make hormones. These hormones include estrogen and progesterone. So in this sense, the most direct way that you can regulate your estrogen production is not only through your ovaries, but through your pituitary gland. And I know in traditional Western herbalism, there are several different herbs that are known to be estrogenic versus progesterogenic. And from an endometriosis standpoint, we generally want to use the herbs that are push progesterone a little bit more, because what we're dealing with oftentimes is unopposed estrogen. So one of the herbs that I actually use most commonly in practice and find a lot of success with is Vitex. This is chaste tree berry. In traditional herbalism, it is known to be more progesterogenic, but actually the way that it works is that it can have a lot of activity directly on the pituitary gland in terms of balancing hormones. So that's one that I use a lot. I think the other piece in terms of hormone balancing here that we need to take into consideration is that the production of testosterone can get converted into estrogen through an enzyme called aromatase. So a lot of the therapeutic approach to endometriosis in general can have to do with trying to inhibit the aromatase enzyme as well to keep staying testosterone for longer instead of being converted into estrogen. And there are several other natural things that do this. I think chrysin is the one that's most popular, but there's actually one that there's another herbal constituent that I use a lot in endometriosis because it works on multiple things. And this one is pycnogenol. I like using pycnogenol. Pycnogenol is a specific extract. It's a patented extract of pine bark. It's a pine resin. And the patented form, which is pycnogenol, can be a little bit expensive. But the reason why sometimes I prefer using the patented form because I know that it is standardized. But if you want to go a little bit more traditional herbalism, then using pine resin, harvesting your own pine resin, I think is also another good option. But the thing about pycnogenol is that it does have some aromatase inhibiting activity, but it also has a lot of activity in decreasing inflammation. Going back briefly to Vitex here, I know chaste tree berries are really popular herbs in a lot of like quote-unquote hormonal balancing formulas. My issue with seeing the presence of chaste tree berry in a lot of the hormonal balancing formulas is very oftentimes there's not a therapeutic dose of it. So with chaste tree berry, I like using an extract that is at least 750 milligrams per day. If it's anything less than that, if it's like 200 or 50 or 30 even, that's not quite enough. The other thing that I also really like to manage hormones in endometriosis is Chinese herbs. And with Chinese herbs, I'm going to get into a little bit more dicey territory here because Chinese herbalism really depends on what your constitution is like. There are three main formulas that I tend to use for an endometriosis presentation. Actually, there might be four of them here, but it really depends on the constitution and what the patient is presenting with. So the first one is Shao, which is a very classic one for pain, for blood stagnation pain, which can be the case in endometriosis pain, where it's very fixed, very stabbing. And then there's Ling and Wen Jing Tang, and these are both meant for blood stagnation having to do with the menstrual cycle. So oftentimes I will pair Ling and Wen Jing Tang if it's like a generalized, really excruciating pain that isn't necessarily fixed and stabbing during the menstrual period. The last one that I thought of here is Danzhi Xiao San, or just Xiao San in particular with modifications. This is in particular if there's also a PMS type of, like a PMS or a PMDD picture before menstruation, and then a lot of pain with menstruation. This one is a classic one for liver qi stagnation, so it really moves things and it gets the stagnation to move. And that's the key with Chinese medicine and endometriosis or adenomyosis, is that you want to make sure that you are moving blood and qi stagnation without depleting. And you also want to make sure to not move too hard when someone is actively menstruating, because very often someone with endometriosis or adenomyosis, they will have problems with bleeding too much and having periods that are too long. So the timing of Chinese medicine is very specific, where you want to move qi and blood before the period actually starts, and when the period actually starts, you want to make sure that you're implementing therapies to stop bleeding. I could talk about this for a long time, but this video is getting long. Those are the main ways that I would herbally treat endometriosis from a hormonal perspective. Brief discussion on another new study with endometriosis. Hi, I'm Dr. Joyce Knieff. I'm a naturopathic doctor practicing in the state of Minnesota. So this was a randomized controlled trial that was published in June of 2025, and this was on whether or not curcumin would be a good adjunct therapy in the pain control of endometriosis. So this study very specifically looked at the add-on effect of curcumin to Dienogest, which is a progestin that is commonly used in the treatment of endometriosis. So they had two groups. Both of them were on dianogesis standard therapy. One of them had add-on curcumin. And what they were doing is comparing the difference in control of pelvic pain between these two groups. And what they found was after 8 weeks of treatment, the combined curcumin and dianogest group did demonstrate significantly greater improvement in pain scores, specifically as compared to the placebo group, who only received the progestin therapy. And the dosage given in the study of the curcumin was nano curcumin soft gel capsules, just 80 milligrams per day. And if you know anything about curcumin therapy, this is not a very high dose of curcumin. There is some discussion that because this was a nano-formulated curcumin formula, that it is more bioavailable, because there has been prior studies on just curcumin that showed that there was very little to no benefit. And I think this is possibly more of like a combination therapy being more effective than monotherapy, because we know that the hormonal influences in endometriosis is so great that if you address the hormones, a lot of the other things will also be a lot more effective. So this wasn't specifically in the discussion of either study. There was the study I'm referring to with the curcumin showing no benefit in endometriosis was done in 2022, and that was done only with curcumin. So that study gave curcumin 500 milligrams twice a day, so a total of 1,000 milligrams a day, 1 gram of curcumin. And this newer study that was combined with progestin only gave 80 milligrams of nanoformulated curcumin. So I think one argument can be made with the bioavailability of the curcumin, because that's one of the supplements that is notorious for very poor absorption. So having a nanoformulated or perhaps another absorption enhancing formula might be more effective in the treatment of endometriosis. And it could also be that you need hormonal control as a prerequisite to the management of endometriosis before something like curcumin will continue to compound the effect of helping pain management. So yeah, a lot of studies are coming out recently that are quite exciting around the realm of supplementation, like just dietary supplements. And I think that's really exciting. And I think we need to have a little bit more around what works together in terms of certain disease processes, instead of just like dismissing that a thing doesn't work because we used it by itself and it didn't work by itself. So yeah, hope this helps. Treating endometriosis from an anti-inflammatory perspective. So I talked briefly about treating endometriosis from a hormone regulation perspective in the previous 2 videos here, but there's also another flip coin of this, because we know that if you have established lesions of endometriosis, that having those lesions increases your serum level of interleukins. So it does increase your inflammation in your body. Also, just have as a self-introduction, hi, I'm Dr. Joyce Knieff. I'm a naturopathic doctor practicing in the state of Minnesota. So to make a long explanation short here, curcumin, resveratrol, rosemary, and pycnogenol are all herbs that can be used to decrease the inflammatory signaling of endometriosis, in particular leading up to the period. So in particular, herbs that are going to help with the COX pathway, that's turmeric, resveratrol. Ginger is also very helpful in this one, especially from like a Chinese medicine perspective. Anything that is warming tends to be very helpful for the uterus and uterus-related concerns. And another piece that I actually work with here to decrease the inflammation across the menstrual cycle, because is not directly during the menstruation. So usually what I will also do with someone who has a high inflammatory picture with endometriosis is I will do fish oil tapers, actually, where like right after the period, we'll taper up the dosage of fish oil and then taper it back down as they approach their period. Because if we're doing that in this case, we're basically priming their body to be have a less inflammatory response when the period is happening, while not taking fish oil during their period, just in consideration for like the blood thinning effects of fish oil. I know it's mild, but when you have someone who has endometriosis/adenomyosis and is bleeding for like 9 days plus straight, sometimes without stop unless you do something about it, we don't want to risk anything about that. And usually for those cases when there's very, very heavy bleeding, I will also implement direct styptic herbs, styptic meaning blood-stopping herbs, when the period first starts, just to make sure that we're eventually going to get towards a period that is more reasonable. I think my favorite styptic herb of all time is yarrow, specifically if it is a fresh tincture of yarrow. But I would say probably yarrow, shepherd's purse, and cranesbill are my three go-tos for styptic herbs in terms of if the bleeding is really heavy and really prolonged. Usually I will have patients start dosing a tincture of those three herbs or some sort of supplement with those three herbs in it as soon as their period starts, or maybe even the day before they know that their period is going to start, just so that we can manage the bleeding and then continue to manage the inflammation across cycles. A lot of the times treating endometriosis is a little bit of a long haul game. You might need to go 3 cycles before you will start seeing some significant regulation and change. But in general, if you can get the hormone balance to work out okay, and B, the inflammation to work out okay, and then managing the pain and the bleeding as you go along, very oftentimes the success rate with treating endometriosis in a way where we shape it into something that is more manageable is the success is very high. So yeah, hopefully this gives some hope, some hope, and a direction to go into if you want to speak with your own providers or herbalists that you're working with. Hope that helped. Thanks. Okay, talking a little bit more about endometriosis, I think the standard of care right now that we have for endometriosis and adenomyosis is severely limited, especially based off of the research that we know right now that really does help with people who are suffering from endometriosis and adenomyosis. Hi, I'm Dr. Joyce Knieff. I'm a naturopathic doctor practicing in the state of Minnesota. So the current standard of care that we have for endometriosis primarily centers around if the pain is really severe, then using surgical excision of the endometriomas and then giving either like a hormone suppressive therapy or a gonadotropin releasing hormone agonist to try to prevent the endometriomas from coming back. And for the most part, the disease modifying process is a combination of these two processes, along with like other modes of like pain suppression and things like that. So it's quite limited in that it addresses very specifically like one thing, whereas we know now from the research that endometriosis and adenomyosis can be from like multifactorial issues in the body. And I know there are other parts to this topic, but I specifically want to use this video to talk about a 2025 meta-analysis that was done in October of this year. And it was not a small meta-analysis either. It was a review of 21 randomized controlled trials that totaled over 1,500 participants. And it found that when antioxidants are given within the context of endometriosis, typically what happens is they significantly reduce pelvic pain, pain with periods, pain with sex, and oxidative stress markers. And this meta-analysis looked at a pretty broad range of antioxidants as well. More than 10 types of antioxidant supplementation, including vitamins, pentoxifylline, I don't know that one, melatonin, astaxanthin, fish oil, and silymarin. And that was on the heels of another meta-analysis here that showed specifically, I think the most effect here with this particular study was that vitamin E with or without vitamin C had a very significant effect in improving pelvic pain and in chronic pelvic pain. So there's actually been a lot to support the use of antioxidants in the treatment of endometriosis, but it's still not part of standard of care, and it should be, because besides just modifying the disease progression, like I think addressing the pain is really important for endometriosis and adenomyosis, because the pain is really what impacts the quality of life for these patients. And if we're talking about overall like risk of treatment and things like that, usually these supplemental antioxidants are very safe. They have very excellent safety data. There are not a lot of contraindications to giving vitamin E and vitamin C, especially if a person is well evaluated. I think the only funky contraindication for vitamin E is if you're on anticoagulant therapy, which would be a more complex case if you were on anticoagulant therapy and also had endometriosis and adenomyosis. Not saying that can't happen, but that would be a much more complex situation. So yeah, antioxidants in endometriosis and adenomyosis. Hope this helps. Okay, so unfortunately there's not a whole lot of research specifically on adenomyosis by itself, but a lot of the research can be extrapolated from adenomyosis to endometriosis because the mechanisms in which these two conditions arise they share a lot of overlap. Hi, I'm Dr. Joyce Knieff. I am a naturopathic doctor practicing in the state of Minnesota. And there has been a fairly old study. It was done in 2007, and it was a fairly small study on 58 women, and they were they all received conservative treatment for endometriosis where they had surgically diagnosed endometriosis. And after their surgery, they were either put on pycnogenol or a gonadotropin releasing hormone agonist, which is second line for endometriosis right now, to decrease the recurrence rate of endometriosis. And what they found with a 48-week trial is that CA125, which is a marker both for cancer and for endometriosis, they went down in the endometriosis group and in the gonadotropin releasing hormone agonist group. It went down a bit more in the gonadotropin releasing hormone agonist group, but also with that group there was more adverse events. With the pycnogenol group, the dosage was also a little bit smaller too. Let me check what it is. The dosage for this study in particular was 60 milligrams of pycnogenol orally a day for 48 weeks. And again, the study is a little bit older. In my clinical practice, I tend to use a higher dosage of pycnogenol. I tend to do 100 milligrams twice a day for something like adenomyosis or endometriosis, especially when we're trying to control adenomyosis, bleeding, and pelvic pain. I will be a lot more aggressive with a lot other different things initially in the treatment phase. As we gain more control over the symptom picture, then that's when we can sort of like taper things out a little bit more, making sure that we're maintaining proper hormonal control and we're making sure to maintain proper antioxidant control in the body. So I would say that pycnogenol is more like a piece of the puzzle when you're treating either adenomyosis or endometriosis. It's a piece that has a little bit of evidence. It works really well in clinical practice, but if you want to go with something that works well and has a lot more research behind it, basic antioxidants like vitamin C and vitamin E, and then like hormonal management approaches have a lot more evidence in their favor. And I can talk about this a little bit more, but like there's been a new study in 2025, again, like a lot of new stuff coming out in 2025, that showed that N-acetylcysteine did help modulate some amount of signaling in endometriotic cells. So that's also exciting. So some of our really basic antioxidant stack, like vitamin C, vitamin E, NAC, that type of thing, can be really helpful in managing the pain and bleeding that happens with adenomyosis and endometriosis. And of course, with adenomyosis and endometriosis, we have all of our herbals that can really help with the HPA axis, the HPAO axis, to be able to regulate hormones in a better way. We have our detoxification pathways that we need to address to be able to make sure that we're properly getting rid of estrogens in like a safe way, because the detoxification of estrogens can be fairly complex, as I've discussed before. And all of this comes together in the treatment of adenomyosis and endometriosis. So hope this helps.